Traditional healers in the Eastern Cape have joined other traditional healers across the country in expressing their grievances over the proposed traditional health practitioners regulations. Two marches were held in the province's Buffalo City and Nelson Mandela Bay metros. The draft regulation seeks to regulate the registration of traditional health practitioners in the country, and traditional healer and coordinator of one of the marches, Phuthumile Fuyani, joins us now via our video link for more on this conversation. Phuthumile, thank you so much for your time this evening here in SABC News. I mean, we've seen an uproar by some traditional healers also bemoaning this regulation. Perhaps give us an insight in terms of really what are the problems presented in this act.
Oh, good evening, ma'am, and your listeners. Ma'am, the aim of the march was to seek or to address the grievances that the traditional healers have on the proposed traditional health practitioners regulation of 2024, and also the interim traditional health practitioners council. There are so many problems, ma'am. One of them, if you understand that as traditional healers, we believe that we have a right as per section 235 of 1996, which means that we have a right to self-determine ourselves. Now we see the Department of Health trying to now regulate us without us being consulted. What happened is that there was a lack of extensive consultation, where consultation in some places, not in some places, most of them, they were done in hotels, in the cities. Like here in the Eastern Cape, it was done at the ICC. And if you know and you understand, most of the traditional healers, they live in the rural areas, and most of them, they live in the locations. So, and they invited few individuals that were invited by them. We don't know based on what category. And then they said those people are representing healers. Also, there's also an issue of cultural significances in the regulations, where we feel that the proposed regulations, they are not fully recognizing our cultural rights or spiritual rights as per the Act says. If you look at them, if you can look at that, the issue of the terminology that is being used there. Yeah. We as traditional healers refer to the people, the initiates, as amatrasa. It will be even better if the document referred to amatrasa as initiates, but the document refers to amatrasa as students, and also use terms like tutors and institutions, which is the language that is not familiar to the community of traditional healers.
And Phuthumile, I'm sorry for coming in here, but I wanted to find out, have you reached out to the health department prior to this?
We have tried. You'll remember, ma'am, that this is now not the first time that the regulations are being gazetted. The regulations were gazetted in 2011, and we rejected them. And also in 2015, we rejected them, and also in 2022, and we rejected them. And now the department, during this period, have tried to consult with the healers, but they've never consulted the healers in a proper way, where we sit and have a dialogue and now table our concerns and how do we feel. Because if you look at it, the actual program is the Act, ma'am, the Act 22 of 2007. It is what is bringing us to this situation today, because it is a guideline of these regulations.
And perhaps maybe are you hopeful that you can have a sit down with the department, and you're saying that they can gather all traditional healers to have some sort of dialogue, because clearly you all need to have this dialogue and engage a bit further before this comes into law?
This is now the call that we are calling for, ma'am. But it seems like the department itself and the government itself, they are not ready and they are not willing to have that discussions with traditional healers. For example, in Pretoria, the memorandum was supposed to be sent in union buildings to the Minister of Health, and it was arranged prior. But today, they were undermined, if I can say so, because they were now sent someone else who is not even aware of the regulations, who is not even aware of what is happening, who was now a public liaison manager of the office of the president, Ms. Phil Mahlangu, to go and receive the memorandum on behalf of the Minister of Health. What is that? It means that the state, it is not willing. We are still marginalized, and the state feels like they can do whatever they want to do with us without accounting for it.
And should this be signed into law and this becomes the regulation, Phuthumile, sorry there for interrupting you again, what do you plan on doing? Because you are saying that, you've raised these issues before, and it seems as if these issues are falling on deaf ears.
As you can see, as you can see, we now, this is a national call. For all traditional healers. It's not based on the province, and we have gathered and we discussing things inclusively and as traditional healers in South Africa. So we now have to go and sit down and look at the second options that we can take in order for this matter to be addressed.
All right, Phuthumile Fuyani, thank you so much for your time this evening. That is Phuthumile Fuyani, is a traditional healer there, just giving us an insight in terms of the march that took place today in both Buffalo City as well as in Gqeberha.